Hare Krishna. Am I audible?
Yes.
Thank you. Thank you for giving this opportunity to present here. It was wonderful hearing uh, other speakers. So we would like to begin our presentation first with the introduction of our project, which is Bhaktivedanta Hospital and Research Institute, which was founded in the year 1998. Few of the doctors were medical students and ISKCON devotees. They came together and under the guidance of His Holiness Sadhana Swami Maharaj, we started this project. And the first thing we had in this entire hospital, we have a sound system where in each and every corner of the hospital, Srila Prabhupada's chanting of Hare Krishna Maha Mantra is going on. Now, many devotees or many patients, when they come to the hospital, they feel, is it a temple or a hospital? But it is a hospital. As Prabhupada said that the temples are actually institutions or hospitals where people are cured. So our hospital is where patients who are not only been taken care physically, psychologically, but also spiritually. So we have, as we understand, the WHO describes health not only as a physical, psychological, or social well-being, but also spiritual well-being. And quality of life model also now considers all these four aspects, because there are many diseases which cannot be cured, but the quality of life can be improved. We used to get many patients at our hospital. We are based in Mumbai city, and Mumbai is a very fast life. So everybody is rotating around the time and rushing with the time. But when patients get admitted to the hospital, so few of the questions, one patient I remember asking me that, Madam, I am staying in this society where there are 1,000 houses and maybe 5,000 people are staying, and why did I get dengue? Why did this mosquito bite only me? Another patient who was saying that I climbed up the ladder to protect a pigeon and I fell and I fractured. I saved the pigeon, but I fractured my hand. So when patients get admitted in the hospital, they have many such inquiries, they have many such queries which cannot be actually answered only by doctors. And they are thinking about all this because otherwise in the routine fast life, they do not have such question, but they are forcibly put in the bed. Then they start thinking that I take the same train every day for so many years, and why did I fall today only and have a fracture? So that's why we have this special department, which is called a spiritual care department. And under the guidance of our director, Dr. Ajay Sankhe, Madhavan Prabhu, he is the one who has come up with this guidelines, which are called match guidelines, which covers the principles of all the major religions: mercy, austerity, truthfulness, cleanliness, and H is for holy name. So I gave many times example to my students that, I suppose a farmer, he gets a Mercedes-Benz car in lottery and he starts using it for farming. What will happen? A farmer uses a Mercedes-Benz car for farming, either the farming will happen, the car will get spoiled, and the farmer will be in depression, anxiety, because he's not going to earn any money. Similarly, the body which is given to us is for a different purpose. But when we are using it for not the right purpose and using it for something else, the body gets spoiled, the work which is given is not performed, and then the person is depressed and anxious. So human beings, they come to hospital when they have birth, death, old age, and disease. And this doctors are constantly been seeing this round the clock. So we have come up with this match guidelines, which is, as we understand here, mercy, austerity, truthfulness, cleanliness, and holiness. And we also, that's why on this basis of this guidelines, we have certain powerful principles in our hospital. We do not allow any diet which is harmful to the animals, no abortion, no intoxication, no gambling, and no illicit relation. And holy name is the medium by which we connect God. So the principles of Bhaktivedanta model of spiritual care is there is no discrimination on the basis of religion, sex, or age. We believe in God. We accept the broad common principles of all major religions. And this spiritual care is manifested through our environment, food, which is prasadam, holy sound vibration, emotional care, and there is direct care of the spiritual needs of an individual. So we have this department which takes care of all the patients. How we have nurses who visit each and every bed. Like that, we have spiritual care assistants who visit each and every bed, and they provide spiritual care. So the foundational basis of this, our model, is God exists and is the most kind person. Even if we have a person with AIDS or cancer due to he has misused his body, he has broken, certain final principles, but still we understand that God is most kind. And when anybody who comes to our hospital is a child of Krishna, and we need to take care of that child as Krishna himself has given us this opportunity to serve this soul to bring it more closer to Srila Prabhupada and Krishna. So everybody needs spiritual care. And whatever activities you do, what you sow, so shall you reap. The laws of karma are intricate. Every individual is part and parcel of God and is connected through service. And the holy name is a medium of connecting with the Lord. So these are our foundational basis on which we give spiritual care. The way spiritual care is given to all the patients is sometimes, they are visiting the beds and they discuss with them. If they're interested, they read Prabhupada's books for them. They teach them chanting or chant with them. There's a lifestyle form where each and every patient, is asked whenever patient gives consent, and about his sleep pattern, about his eating habits, about his some exercise, physical activities, and then slowly the spiritual care assistant makes some rapport with the patients. And if patients are more inclined, then they are given more spiritual therapies. So even the relatives of the patients are also encouraged. Any patient who is undergoing surgery, so that time there are a lot of anxiety. They are, and that time our spiritual care assistants visit them. They read for them. Sometimes they chant with them. We have a special service, which is end of life care. Any patient who leaves his or her body in Bhaktivedanta hospital, with the permission of the relatives, we put Gangajal, Tulsi, and read Bhagavad Gita for them. Whether the relatives visit or not, Lord Jagannath, Baldev, Subhadra, we have a chariot, Rath. They visit each and every patient, and every patient offers a flower and get prasad. For all the employees, the spiritual care is not only just for the patients, it's for all the employees, doctors, and staff. And we have 4 times a day 6 Sastrakam prayers. So you can see here, we have Sij Kirtan and Srila Prabhupada's lecture in each and every corner. So now, since we were doing this for many years, but we needed to document the effects of whatever the spiritual care has been given to the patient, what is the effect on the patient and the staff. So under the guidance of Dr. Ajay Sankhe, we started in 2012, the spiritual researches. Dr. Vijay Kumar Gavli is also one of our doctors who is a director, one of the director in the hospital. And under his guidance also, we started this research department, and I started doing my spiritual researches, spiritual care researches. So mainly we understood it is the mantra studies, because we strongly believe that it is the hearing sense which connects the person to the super soul, or the soul gets connected to the super soul. Because many times our patients were brought unconscious to the hospital, and whenever they became conscious, they said, I remember exactly when I entered the Bhaktivedanta hospital, because I could hear the Kirtan, Hare Krishna Mahamantra. So this Mahamantra is such a powerful process as Srila Prabhupada has given us, that it straight reaches to our heart. And our principle of the spiritual care studies are that, as we understand Bhagavad Gita, that there is this external body, and there's Sukshma Sharir, and then there is Atma. So Sukshma Sharir is made up of mind, intelligence, ego, and then there is a soul. So most of the time, the doctors try to treat on the physical level. Definitely, we know all the other pathies, and even Ayurveda says the diseases are usually begin in the mind. But we go to one step deeper, that we want to heal the soul. We want the soul to hear the Mahamantra, connect to the Lord, and then let us see what is the effect on the mind and the body. So this is one of our research, that evaluation of the spiritual effect of spiritual care on patients with generalized anxiety and depression. It was a randomized control study. So we had 100 patients, and these were the patients of our psychiatrist who had anxiety and depression, and he was already giving them the highest level of dose. He couldn't increase the dose of the medicine. So we took those 100 patients, divided them into two groups. One group had spiritual counseling under the match guidelines, and basically to make them understand that how it is important for you to hear morning and evening 15 minutes of Hare Krishna Mahamantra. We had patients from different faith who agreed, who consented for this. And then we were, there's a score, hem anxiety score and hem depression score. So we took those scores at the time of admission, at the time of they entered the study, then post 3 weeks, and then 6 weeks. And here you can see that the anxiety score, which was at baseline, this is in the intervention group, the patients who took spiritual care or the heard Mahamantra for 15 minutes. If anxiety was at 31 at the baseline, it became, after 3 weeks, it reduced to 25, and 6 weeks, 17.3. Depression also reduced from 22.6 to 14.1 to 9.4. In fact, all these patients, we had to reduce their medicines. And facet spiritual care, their spiritual well-being improved from 26.9 to 33.8. So this study definitely shows that how hearing of mantra actually helps in anxiety and depression. Then we have another study, onco-spiritual study, because cancer is one of the fastest growing disease in the world. So here in this study, we had cancer patients and their caregivers, because many times the caregivers also, they undergo a lot of psychological difficulties. So in this study is also published in Springer. And here we have taken totally 250 cancer patients and their caregivers, and we followed them up for 6 months. In this study, we have taken patients and caregivers of different faith, and we encourage them as per their faith to hear or chant and read the scriptures. And we were doing counseling on the match guidelines, because many of the cancers are spread because of the wrong diet and intoxications, tobacco chewing in India especially, or even smoking or non-vegetarian diet. So we were counseling both patients and the relatives. And then we followed them up for 6 months. And here most of the patients were HFN's head, face, neck surgery. So many of them actually could not even chant. So they would hear, they would read, and the relatives would be chanting and reading for them. And we saw that their follow-up, when we took, these are the facets, general well-being and spiritual well-being. And we could see that the general well-being improved almost by 64% in cancer patients and 61% in their caregivers during 6 months. One of the most important things for the cancer patient is fear of death. And we could easily see that all of them, they did not have fear of death at the end of the study. And they were saying, we are prepared, we are ready, that yes, there is a next life. And whatever we will do now, it will have the effect on the next life. So they started becoming more spiritual. So the spiritual well-being also improved. So this is also, we can say, educational program under match guidelines, where we can see that, not only they are given the treatment, the chemotherapy, radiation, surgery, but also they are guided under our spiritual care assistance, that they take more spirituality. You can see here the physical well-being markedly improved from 15 to 21.5 at the end of the discharge, and at the end of the 6 months, it was 24.9. Similarly, in the caregivers also, physical, social, emotional well-being, and functional well-being, everything improved. This study is about cardio-spiritual study. Here, what we did was we had heart patients who were undergoing angioplasty. So this is planned angioplasty, not emergency angioplasty, because planned angioplasty, we had patients who were admitted and we could make them hear Hare Krishna Mahamantra. So here also we had taken 100 patients, 50 patients, and under the study group where we would make them hear Prabhupada's Hare Krishna Mahamantra before their surgery, post their surgery, till the time they were admitted. And 50 of them were just normal routine standard of care. But let me tell you that in our hospital, since there is a lot of spiritual environment, so that also has good impact. But to compare, we had taken this where they heard 30 minutes just before going for surgery, angioplasty, Hare Krishna Mahamantra by Srila Prabhupada. And even after post-surgery, they were hearing for 2 to 3 days. And we could see that here, most of this angioplasty patients, post-surgery angioplasty, they undergo depression and anxiety because they realize that, they had a very major surgery and their heart is really now affected. So we could see here that anxiety and depression score reduced, and also their hospital stay reduced. That means the recovery, post-surgical recovery happened much faster. Now, this is a very interesting study. This is a study on diabetes. So we know that diabetes is #1 disease in India now. It is so prevalent. And diabetes has its own consequences. Once you have diabetes, then there is stroke, heart attack, kidney failure, eyes problem, peripheral neuropathy, so many things. So we had patients who were already under the treatment of endocrinologists or the physicians, and they were on medicine, some of them on insulin, but still the sugar would not come down. So what we did was we put one CGMS device, a small chip in the body of these patients, 30 of them, where we could do continuous glucose monitoring, what is happening to the glucose levels in the blood. And what we did was that these patients whose HbA1c, that means the 3 months glucose level was 7 to 8.5, age group was 18 to 65. And then we gave them something, we named it Bhaktivedanta audio therapy. So here there was 2-3 more things besides Hare Krishna Mahamantra. We added Dhanvantari Mantra, Aditya Hriday Stotra, and also Raga Chikitsa. Raga Chikitsa is one of the, in Ayurveda, it is about, how different ragas can have different effects on your body. So we had 2 ragas, and we had made that time we made a CD or we gave them in a pen drive. And whenever they could hear the entire CD, they had to hear once in a day. And then we were seeing their glucose levels for 14 days. Where we had the CGMS device, which would actually check their glucose levels. And you can see here, the glucose levels, you see the blue one is when they enter the study, and the green one is post day 7 and day 14. The red is day 7 and green is day 14. And we could immediately see that these patients had drastic effects on their blood sugar levels. In fact, some of the patients' medicines were reduced. You can see average glucose levels on the day 1, day 7, and day 14. Day 14, the glucose came down. You can see the day 1, sometimes the glucose was almost 200 to 250, which is very high, which is not controlled. But it came down much lesser. This is also another way to look at this. Even you could say that the different in the time in range, how many times in the day the patient was in the range and out of the range, that also we could see it really improved. So we can see here that many of these diseases, the lifestyle disorders, one of the prime reason is stress or the lifestyle which is causing their entire hormonal system to go haywire. So at that time, because of this mantras and raga, we could see that parasympathetic stimulation was there. Patients are more relaxed, and there was natural blood glucose control. So there was a significant drop in average glucose level, and also we followed them up for 3 months, and their HbA1c also had improved. So this we can see that it helps in glucose control and reducing glucose variability and reduces the burden and improvement in the quality of life. So this is another study on dialysis patients, because we know dialysis is consequence of chronic kidney disease, injury to the kidney. Thrice or twice in a week, they have to come to the hospital, and they are seeing the entire blood going out because the kidney cannot do the function of cleansing. The blood goes out in the machine and then again comes back. So 3 hours, patients are quite depressed. So what we started when they are admitted in the hospital, when they are coming for the dialysis, they would hear this Maha Mantra and Ragat therapies. And we could see that clearly. Again, here also there was a control group and the intervention group. Control group means they were not hearing anything. And the intervention group is patients who were hearing the mantras and the raga therapy. And we could clearly see that the quality of life, the kidney quality of life, it really improved. Now, my another very important source of giving spiritual care to the babies is through the mothers. So we have developed a detailed program on Garbha Samskar, where the pregnant women of the hospital, pregnant patients, they have been regularly given different talks and practical sessions where they are inspired to take up chanting, read books, and also practice, worshipping Tulsi, or some of them, they are more inclined than worshipping the deities. Also, we try to stimulate through the 5 senses the brain of the mother, and which in turn stimulates the brain of the baby. So we try to spiritualize all the activities of the mother. Suppose we encourage them that, if you are doing crochet, painting, or stimulating your right brain, by hearing the music, then it stimulates the brain activity of the entire brain. If you stimulate one part of the brain, the entire brain gets stimulated. So as we understand the Masaru Emoto effect, which is like when there is a research, Japanese scientist who has done that when a water molecule is getting converted into ice, and if you speak some positive words, I myself have done this experiment when I was in Switzerland, and you could see I was speaking Maha Mantra, and then I would observe the crystal which is formed under the microscope. And the beautiful crystal if you're speaking Maha Mantra or any positive thoughts. But if you have negative thoughts or negative emotions, then the crystal is this is not formed properly. And our body is made up of 70% water. And in the pregnancy, the body embryo is developing. So if that time the mother hears spiritual therapies or spiritual mantras, it definitely has deep effect on the child. So I'm not going in much detail. We have completed this study. We are in the process of publishing it, but it has a lot of effect on the mother. And our also second part of the study is we are going to observe the children and see the IQ level or overall what is the development. Few other studies which are ongoing are on the diabetic patient, gestational diabetes. I'm just rushing through these slides because I think I want to finish it fast. So this is ICU patients or NICU patients who are really critical, and we are doing a research with mantras, and we have got very good results. On autism. Autism also we are doing researches, and we have seen that with mantra there is improvement. Surgery patients, pre-surgery, when we are giving them Hare Krishna Maha Mantra, and we are seeing that during surgery and post-surgery, the improvement is much better. Now, another interesting topic is thanatology. Thanatology is a discipline of study and research that deals with death and death-related topics. This was given to me by His Holiness Bhakti Rasamrita Swami Maharaj, who was connected to our hospital, and he said, we must have a thanatology committee. We are back in the year 2010. And we have a thanatology committee who basically is working on near-death experience, reincarnation, and out-of-body experience, because we do come across in our hospital few cases of near-death experience and out-of-body experience. Recently, we had one devotee patient, and she she came for some checkup, and then we realized that her liver was failing and heart was functioning only 25%. She was in ICU. It was a day of Akshay Tritiya, and she suddenly, her heart stopped for a few minutes, and she survived. But when I spoke to her, we did under our research protocol. When I spoke to her, I asked her, did you have any near death or out of body experience? And first, she did not understand. She did not answer me like that. But when we went through our research protocol, the Grayson scale, and she mentioned to me, yes, during I was thinking I'm sleeping, but she said I saw light. I was going through something like a tunnel, and then I was constantly praying to the light that please, I have small kids and I want to chant. She's a devotee. She's the initiated devotee. She said, I want to chant attentively. I promise I will chant, finish my rounds in the morning. And she was seeing her spiritual master, and she was constantly praying to spiritual master. And the next thing she remembers is people tapping her, trying to wave her that you recognize us, because her heart had stopped and again it had started beating up. So she had a near the experience. Some of her patients, like one of her patients who was from other faith, and he mentioned that he came out of the body. He was hearing the conversation between the doctor and his son, and then he said, I was getting dragged very, very strongly to a dark region. And then I saw two big eyes. They pushed me back into this body. And next,
We may have lost Dr. Komal. Some internet issues, perhaps. Let's just wait for a few seconds, see if she comes back. Dr. Komal, are you still there?
Krishna.
Yes. Sorry, we had lost you for a moment. But
Yeah,
yes.
can I share?
Please go ahead. I could also share from my side. Maybe your internet connection